Good afternoon, everybody. Welcome to our media question and answer session that we have been doing weekly for many, many weeks now related to COVID-19. We appreciate people joining us. We appreciate the questions that come forward by the media so that we can provide information that is of interest to the community. As always, we'll walk through today some data, both our local Eau Claire data as well as data from across the state. We'll do some updates related to COVID-19 and then answer media questions. Like always, if media has questions that they'd like to put in the chat, Audrey is monitoring that offsite and will let me know if there are questions coming in that way. Or at the end, if you'd like, you can also unmute and ask questions at that point. So again, thank you for joining us. It is January 28th, 2021. Again, the very end of the month. It's hard to believe that the next time we're together, it will be February, already a full month into the new year. So to start with, our Eau Claire County data. So we are now at over 10,000 positive cases again of COVID-19 with Eau Claire County residents. Our count is now 10,475 individuals in Eau Claire County have tested positive for COVID-19, an average of about 35 cases a day for the past 7 days. Again, our goal is to get below 10 cases a day. We are in a much better spot than we were a couple of months ago, but we have a distance to go to get our case numbers to be lower. Our active cases are now at 355 individuals that are currently isolating with COVID-19 and all their close contacts as well. Again, that reminder that the way we slow down disease progression in Eau Claire, one of the most important ways is that we have people test. They know that they are positive then. Their close contacts stay home in case they become positive, and we don't spread to the next circle of people. We also are now at 335 individuals that are Eau Claire County residents that have been hospitalized at any point during their time being COVID positive, an increase of 13 people since last week. And now 97 Eau Claire County friends, family, neighbors have died related to COVID-19, an increase of 2 people since last week, Thursday. We also share with you once a week a bit of other data related to Eau Claire. We are now at 412 individuals connected to the Eau Claire County Jail that have been tested. We remain with 26 individuals that have tested positive through that. Our UW Eau Claire cases are about 14% of our cases since September. UW Eau Claire will be going back into session next week, and certainly we continue to work with them very closely as they really lean in to test their students, faculty, and staff, and to work on the isolation and quarantine that's needed, just like the rest of our community. We are at now 53 active public health investigations for Eau Claire County. Again, those are in education locations, work sites, long-term care, or congregate settings as well. Our state rating for COVID-19 remains at very high. That very high means that we're over 360 cases in a 2-week period. Right now, we are at 533 cases in that 2-week period, so well over that threshold for very high. Our ongoing goal, as a reminder, is 150 cases. So again, just like our daily case counts and our numbers that we are reporting, we have a ways to go, but our trajectory is flattening. And that is good. We are looking forward to that starting to go down significantly. Our positivity rate is a little less than 10%. It's slightly up from, it's at 10%. It's slightly up from last week. Again, we watch that carefully. That's a sign of not only how much disease is spreading in the community, but also what our testing looks like. So again, testing is down a bit. 444 tests a day on average is what we're reporting. Please seek testing if you have any symptoms of COVID-19, if you have been a close contact of someone with COVID-19, or you have any reason to be concerned about potential exposure. There is testing available in Eau Claire County 7 days a week. We are very fortunate that we have those resources available to us. Please go to the COVID-19 Eau Claire website and find information there about where you can get tested. Our regional hospital bed capacity remains good, and that is good news. Inpatient beds are at that green status, and the ICU bed space is at yellow. Again, we need to keep that well below the red range, which is extremely concerning when it happens. Our community spread measure is at 42%. Again, to name that 42% of our cases don't know how they got COVID-19. It wasn't from a close contact that they were aware of. So 42% is an increasing number. It is something that we are watching. Case contacts, that measure is the measure of how quickly we can get to cases and talk to them about staying home and isolating. We're at 87% of people now that are contacted within that first 24-hour period. Again, our capacity to get to cases and close contacts is much improved now that our case numbers are lower. Please do find all of those different measures again on our COVID-19 Eau Claire website. There is really good information there. The dashboard showing those red, yellow, and green measures is also there. And it is a way to weekly at least get a sense of how things are going in this community. Our state update with data, we are now at 538,348 Wisconsin individuals that have tested COVID positive since the start of this pandemic. Our case activity rate in the state as a whole remains very high, just like it is for Eau Claire County. And we are now at 5,811 Wisconsin residents that have died related to COVID-19, an increase of more than 200 people since last week, Thursday. Again, something that we all should care a lot about, a very large devastation to those families and those communities where those deaths have occurred. A couple of quick updates. The first is that around testing. So again, please check our website. There's a testing tab on that website with all of the information about testing. Antigen testing changes have happened. So a couple of weeks ago, it was indicated that the UW system and the available testing that came in through UW system and the federal Health and Human Services Department that UW Eau Claire then had available at Memorial High School, that ended, and it did. It is now starting back up. Will be available at Zorn Arena on campus at UW Eau Claire for community members. That Zorn Arena site is available for community members on Tuesday evenings and on Saturdays and Sundays. Please look at our website for more information on that resource for antigen testing. Again, that is really primarily there for people that do not have symptoms of COVID-19 and are getting a screening test. If you do have symptoms of COVID-19, please get the PCR test that is available at the other testing locations. Walgreens in Eau Claire, the Walgreens on Claremont, does also now have PCR testing, the gold standard for testing, available at their Claremont location. It's a self-administered nasal swab, and it is an appointment-based schedule at Walgreens. Please see more information about that as well on our website. So the other sharing that we want to make sure people hear about is related to vaccine. We know that is the topic of the hour and an important topic. We are really thrilled to see that we have more than 10,000 doses of vaccine given in Eau Claire County to date. I believe today it was noted that we are at that 11,000 mark. That is good news. But we have a long way to go, and the more vaccine we can get into arms over the next several months, the better we will be. A couple of notes for you. In Eau Claire County, we have a a strong cadre of vaccinators. You need to be an approved vaccinator to give COVID-19 vaccine, and we have strong vaccinators in our community. Not every community has that, but we do have several entities across Eau Claire County that are vaccinating. Um, but vaccine is limited. So the other note for everybody to be aware of is that the vaccine coming into Wisconsin is limited. With the allotment the last couple of weeks, vaccinators, like our whole team in Eau Claire County, did not get the vaccine that they requested for the clinics that they were planning because there's not enough available across the state to allocate. Today, we heard that there were 4 times the number of requests by vaccinators for doses than what will be available to give out for next week. So we know that there is much less vaccine than there is capacity in our community to give vaccine. We ask for people's understanding and patience with that. It will take a little bit of time as we get vaccine to get it out to people. Our biggest barrier right now is vaccine being available. Each week, again, a reminder that the vaccinators in our community, Marshfield, Mayo, Prevea, Oakleaf, and the health department and others ask for vaccine. We have to submit a request for that. Each week, we're told by the weekend how much vaccine we will be receiving for the upcoming week. That is why we are asking you to go to the website on the COVID-19 Eau Claire webpage. It's very prominently displayed on that website with a button to go to say, I want to be vaccinated. That button will take you to a location that lists all of the different vaccinator locations and asks you if you have a primary care provider, and you typically go to that care provider to go to that tab. If you're a Mayo patient, for example, to click on the Mayo tab and follow the instructions there for how to get a vaccine if you're currently eligible. There is also a tab at that site for the health department vaccination clinic. Each vaccinator is putting out their appointments and their processes on that web page. And when we get vaccine, we are giving out all that we receive every week. It is a challenge, and we know that. We know that people are really looking for a vaccine, and that's a good thing. We will get appointments out and information out as quickly as we have it available for all of those eligible populations. Right now, again, a reminder that eligible to receive vaccine are those individuals that work in healthcare settings, those healthcare entities, those people that are doing direct care to individuals. Also eligible are law enforcement and fire personnel that are working face to face with individuals. And now, newly eligible this week are those individuals 65 and older. Announced this week were the newest group of individuals that have been prioritized to receive vaccine in the next round of announced eligible groups. The state has indicated that may not be before March 1st, but the groupings that are in that next stage of vaccination include educators, so childcare, K through 12, and higher ed. It includes some essential workers like utility workers. It includes a number of other populations that have been specifically named by the state as the priority groups that will come next. In our community and in most communities across the state, there is a lot of coordination happening with those groups. Right now, the vaccination group, so all vaccinators in Eau Claire County, are working together to sort out the most efficient ways to get the current groups vaccinated, and as we get additional vaccine, the upcoming groups. So conversations are happening with educators and those groups that represent that population, with childcare entities, and with others as we are planning for the next phase of rollout. Um, do know that that is important work. We wish we had enough vaccine to do everybody right now, but as we progress through and as eligible groups are named, we will continue to work together in Eau Claire to make that happen as efficiently as possible. So also a reminder that the big group that has been announced is sizable. So more than 18,000 people in Eau Claire County are in that 65-year-old group. And that group is being vaccinated as we speak in clinics across Eau Claire County. So continue to go to the website, view there who is eligible. If you have questions about your eligibility status, you certainly can call the COVID hotline. That number is 715-831-7425. We do know that in the 1B group or the next priority groups, there will be many questions about who specifically is eligible there. As we have more information from the state about the details of who will be eligible in that group, we will absolutely include that on our website as well. So we have really as much clarity as possible about who is eligible in each of the groups that is announced. So the other announcement I'd like to share is that our community expectations were updated. Community expectations is the document that we have had available since the public health order locally was ended this fall. The community expectations document does guide how we work with schools and businesses and events and entities across our community to have the safest practices possible given COVID-19. Those expectations really name individual expectations for each of us, as well as public entity expectations and group gathering expectations. All three of those are separate parts of the expectations document. As an individual, you should look at it. If you are a public setting, you should look at that document. And certainly if you are planning any type of gathering of a group size, please look at those expectations. They do frame, based on our disease rates and the current evidence, what will make for a safer community. We all working together on following those expectations will mean that we will have slower disease spread. It'll mean that we will be able to keep our businesses and schools in better shape because we have fewer people that are out with COVID-19. So the goal with that document is that we are all paying attention and following what are in those expectations. If you haven't reviewed it recently, please do go to our COVID-19 Eau Claire webpage. There is an expectations tab there, and the document is loaded at that tab. A couple of quick things to walk through that were included in the expectations document this time around. It hasn't been updated since November when we had an enormous uptick in cases at that point in time, you may remember. So the expectations document has reflected the lower case volume now. That was why we made the revisions that we made. We still expect all of those basic mitigation strategies. So wearing a mask, keeping 6-foot distance from people that are not part of your household, staying home as much as possible, and certainly staying home if you have any symptoms. It does add content about developing a plan to get vaccinated when you're eligible so that we really lay out a community standard that if and when we can be vaccinated, that we work to make that happen for one another. We also name that supporting our community financially, if they're struggling, individuals and others, is an important part of our process with COVID-19. We also did in the section around large group gatherings, name that with all of the other expectations being met, so 6 feet distance between households, wearing a face covering, knowing who you are with, so documenting who is at the event and their contact information, and all of the other basic expectations, with those being met, those things that exist in paragraph 2 of that document. If that can happen, then there is now ability in this expectations document to have gatherings of 100 or fewer indoors or 250 or fewer outdoors. So it does change that from what was previously listed as 10 or fewer for any type of gathering. So with that, again, a reminder, COVID19eauclaire.org. You can find all of the resources that I've been talking about. The call center number is 715-831-7425. if you have questions after looking at that resource. I'll walk through some of the questions we got from media in advance and then ask Audrey to help if there are additional questions after that. The first question is related to something that's gotten some media attention, Dr. Fauci talking about double masking and whether or not that is a good idea and if it's recommended in Eau Claire. The basic science and data and recommendations that we have right now is related to the wearing of one multi-layer, well-fitting face covering. Critically important that that face covering is well-fitting, really closely fit to your face, and of a couple of layers. There's certainly may be good reason to consider more than a couple of layers, so that double masking may provide some additional benefit. And we will be watching what the CDC and the state says about that recommendation moving forward. At this point, our goal is really, as we have said all along, that masking is to help support the protection of our community. It is much more from the science about protecting those around us than just protecting ourselves. It's about my droplets not going to others and my air not passing without that filter of the multiple layers of close knit fabric going to others. That basic strategy is critically important for our community. And again, getting at least that double layered mask on, the couple of layers of cloth of a single mask is critically important. There was also a question about the impacts to WIC and food assistance and other food programs in our area if the legislature does overturn the order that is in existence at the state level and the corresponding face mask mandate. The legislature this week does have a joint resolution that is going through the legislature. The Senate did pass that joint resolution earlier this week that would end the emergency declaration for the state and would, by doing that, end the current face mask order at a state level. Questions were raised to the state legislature related to some unintended consequences, perhaps related to that overturning of the emergency declaration at a state level, one of which is connected to federal food aid and food programs coming into the state. That is being explored right now. The Assembly made a decision today. They were going to vote on that joint resolution today. They did make a decision in the last couple of hours to hold on that vote until they got more information. It is true that there are a number of consequences to our community, to Eau Claire County, if that emergency declaration and the face mask order does get overturned. Again, basic best practice to protect people in our community. If we're wearing a face mask, it protects others in the community. That basic order being consistently in place in the state is a critical measure, and there's good science behind it. The emergency declaration also impacts so many things for our local community as well, including issues around having funding available to support our isolation and quarantine measures for people experiencing homelessness. So again, at a local level, we've shared some basic information about the consequences to our community if those measures are overturned. There's also a question about getting a sense about how full appointments are for COVID-19 vaccination in Eau Claire County right now. And do we have a sense at the health department about appointments being available and how that might happen for especially that 65-year and older population? We do continue to see very strong interest by those individuals that are 65 and older. That's a good thing. The reason this population was identified as the next group to be eligible to receive vaccine is really that the data shows us that the risk of individuals being hospitalized and dying from COVID-19 goes up with age. We do know that that age group is large in our state. And as I said earlier, in Eau Claire County, that amounts to probably more than 18,000 individuals. Again, we are not getting sufficient vaccine into the county within that week's time frame to vaccinate everybody. So there are more people that would like to get vaccinated than have been able to this week, and certainly for many weeks ahead. Appointments, my understanding, at all of our healthcare provider locations and at the health department filled up very quickly once they were announced and available. We encourage people that are over the age of 65 and anybody else that is eligible currently to be vaccinated to really go to our website to monitor that regularly. It changes as we find out about additional doses being available, if we find that out, and to monitor that and sign up as quickly as you can for an appointment. We do know that a number of individuals got vaccinated this week that are over the age of 65. That's good news. I was happy that my over the age of 80 mother was contacted by her healthcare provider. That healthcare provider has a policy right now of vaccinating those that are over the age of 80, and she was one of the fortunate people in that group that was able to get an appointment. Each healthcare provider is doing it a bit differently. We encourage you to work with them and make your appointment and stick with it. One of the challenges all of the vaccinators have is if people sign up at multiple sites for vaccine appointments and then don't show up at some of them, or they make multiple appointments. It really creates challenges in our community if we don't do this as efficiently as we can. So while we know it's hard, please sign up for one appointment and go to that appointment. And we will get through everybody as quickly as we are able to with the doses that are available. We also know that there are people in this community that might have some significant challenges in accessing what is mostly an online appointment system. There are phone numbers available for all of the vaccine providers in Eau Claire County. If someone needs to talk to someone and have them help them walk through a vaccine appointment, please do that. If you know someone that is struggling and is eligible for a vaccine, please help them. Reach out to friends and neighbors and those people that may have challenges for all kinds of reasons, whether it's transportation or access to a computer or even literacy issues. Please reach out and be that resource. We do have resources at the health department, at the call center. There are other resources available at the Aging and Disability Resource Center and other locations. We recognize that need and we really want to make sure we meet that in this community. We don't want anybody to fall through the cracks because they don't have the same resources others may have to get an appointment. Please plan your appointment well. It will take time once you have your appointment to get through. There are some lines as you get there. Typically, you will be processed through quickly. You will have to wait after your appointment. So please know it's not going to be a simple in, out, get a shot and be done in a couple of minutes. It will be a bit of time. Please plan ahead for that as well. So with that, Audrey, I'll turn it back over to you to see if there are any additional questions that came in via chat.
Yeah, we do have a question about whether how many vaccine doses were requested last week in Eau Claire County and how many were received in reference to the demand being 4 times greater than the supply statewide.
Yeah, thanks for that question. I think we shared last week, and it's the same answer, unfortunately, this week, is that right now there is not a system to share the vaccine allotment or how many vaccines were asked for by jurisdiction. So we don't have an answer for how much vaccine was made available for Eau Claire County residents at this point in time. We do know that every vaccinator in Eau Claire County, we met yesterday with that group, that every vaccinator received less vaccine than what they asked for. So we know all vaccinators had that dynamic. We are anticipating, based on the announcement this afternoon, that because of the incredible large volume of asks this week for vaccine for clinics next week, that will likely continue again, that none of us that asked for a vaccine will get the full allotment. So we are waiting to see. We typically hear on Friday or Saturday how much will come in to each vaccinator. We're continuing to work on strategies to document that as a healthcare and public health grouping of vaccine. Do remember, though, that our healthcare entities in Eau Claire County are serving people across the Chippewa Valley. So the vaccine that arrives here is not just for Eau Claire County residents. We also know that people come to all clinics from a wide range of locations. Again, our ask is that Eau Claire County residents go to Eau Claire County sites. We continue to have that ask. We know that some people are choosing to look far and wide for the soonest and nearest vaccine. We ask that you, with limited vaccine available statewide, really have patience and look for a vaccine available in our community and access it that way.
There were no other questions in the chat box. Would anyone like to unmute and ask their question of Liska?
Right. Again, thank you, everyone. Thanks for what everybody's doing across the community, our businesses, our schools, our government entities, all of the individuals in this community that are finding ways to make things work in Eau Claire. I'm impressed every single day at what I see. And the more we lean in to stay healthy individually and to do those basic mitigation strategies, the easier this next number of months will be. So thank you for that. And with that, we'll be back next week with updated information.